All right, well, hey there, I'm Dr. Hagmeyer, and I want to welcome you back to my YouTube channel now. Today we're talking about Candida, and that means if you've been dealing with brain fog and fatigue, bloating, skin rashes, sugar cravings, vaginal yeast infections, or ongoing recurrent sinus infections, you've probably heard of something called Candida, or Candida overgrowth, I should say. But the bigger question is, what causes Candida to spiral out of control in the first place? Today I'm going to break that down in terms of what the top root causes of this Candida overgrowth are, including what most doctors often overlook, and that's something called secretory IgA. So Candida is a type of yeast. Yes, it's a fungus that naturally lives in your body. In fact, we all have Candida. It's in our mouth, it's in our gut, and other mucosal surfaces, and that's completely normal. But Candida becomes a major problem when the immune system and the microbiome fail to keep it in check. That's when it transitions from a harmless yeast into an invasive organism that then penetrates the gut lining, produces all kinds of toxic byproducts, and it just wreaks havoc on your immune system. So the question becomes is what causes this shift? What allows Candida to overgrow? Let's take a look at some of the top root causes, starting with one that, again, most people never hear about. So we have to talk about secretory IgA. What is it? Well, it's a key immune molecule produced by your mucosal immune system, B cells. And it's very important in the gut lining. I want you to think of it like a shield. Its job is to neutralize pathogens like bacteria, virus, parasites, and yeast, including Candida, before they cause problems. But when your secretory runs low, that shield is broken down. Candida now sticks to the gut lining. It creates these biofilms. It releases toxins. And that's when symptoms begin. Low secretory IgA is caused by many things: chronic stress, poor sleep, overtraining, burnout, chronic ongoing gut infections, poor diet, use of medications like steroids, antibiotics, and birth control. And if you're not testing secretory IgA as part of your intestinal workup, you could be missing a huge piece of your health puzzle and why you're not getting better. All right, so that's the first cause. The second major cause of Candida overgrowth is antibiotics, right? Antibiotics wipe out both good bacteria and bad bacteria in the gut. They don't just affect yeast, but what happens is without competition, Candida has this room to thrive, and a single course of broad spectrum antibiotics can shift your microbiome and it can trigger this overgrowth, especially if paired with a high sugar diet, low fiber diet, and medications like birth control. Now, if you've had multiple rounds of antibiotics for things like strep throat, urinary tract infections, maybe even acne, the rise goes up of the likelihood of developing yeast overgrowth Candida. Now, you've probably heard of this one before, but it's still worth mentioning because it's a major culprit, and that's the fact that Candida thrives on sugar and refined carbohydrates. It literally feeds off glucose, and it uses it to grow, spread, strengthen, and reinforce those biofilms. That means eating foods like bread, pasta, cookies, crackers, sweetened beverages, fruit juices, or eating excess fruit, consuming alcohol, even in moderation. And keep in mind, it's not just what you eat, it's also how often you eat that. So that means frequent snacking or eating late at night can also create this environment that keeps this Candida active and thriving. Now, once Candida overgrows, it produces enzymes that break down your gut lining, making it more permeable. And this is what we call a leaky gut or intestinal hyperpermeability. But here's the kicker. Leaky gut also makes it easier for Candida to spread. So it becomes this vicious cycle. Gut inflammation caused by food sensitivities or infections, toxins, and alcohol and medications. It just creates this perfect storm for Candida to grow wild. So if you have chronic GI inflammation and leaky gut, it's crucial to ask if this Candida is part of the problem. So we also want to talk about some of these other root causes that also often get overlooked. Chronic stress. We know that chronic stress lowers secretory IgA levels. We know it suppresses immune function. We know it affects gut motility. We know chronic stress influences biodiversity of the gut. We know that steroids and immunosuppressant drugs like prednisone can depress the immune surveillance, meaning it shuts down secretory IgA levels, which allows Candida to overgrow, along with other bacteria. We know that heavy metals and toxins like mercury, cadmium, lead, these environmental toxins can weaken the immune system. They can influence methylation pathways, and they can also encourage fungal overgrowth. All right, so let's do a recap here in terms of some final thoughts, right? We know that candida overgrowth doesn't happen by accident. It happens when your immune system, your gut lining, your microbiome all become compromised. So the key here is keeping your gut healthy. Some of the biggest root causes include low secretory IgA, which again is your gut's first line of defense, frequent antibiotic use, high sugar diets, leaky gut and chronic gut or intestinal inflammation, hormone imbalances, medications like prednisone, steroids, birth control pills, chronic stress, again, because of its influence on the immune system. If you're dealing with recurring candida, whether it's fatigue, bloating, skin rashes, or yeast infections, it's time to stop chasing these symptoms and get to the root cause. Just cutting out sugar, taking antifungals is not going to prevent a relapse. Getting to the root cause starts with testing. Remember, you can't fix what you don't know, and that means testing your gut more in depth, looking at secretory IgA levels, looking at bacterial overgrowth and infections, looking at markers of inflammation. So if you've been struggling with these issues, contact my office. I'm Dr. Hagmeyer. I want to thank you for watching today's video. And remember, gut health, it's the foundation of your total health. And if you like today's video, here's another video, either in this corner here or in this corner here, that I think you're going to like as it relates to gut health.